I have a mobile unit that goes to the nursing homes, and we actually take stuff into the nursing home, even though we have a van, but we do not use the van unless it's some sort of complicated extraction. We do carry everything in, but also we have local where we go to people's homes. And we have, we go in the homes and we have an app where they can, or call us kind of like an Uber. So it works great. So I understand the complexities to serving seniors in their homes, especially during COVID-19. Now, let me ask you something, Doc. You also specialize in patients with dementia.
Right.
And you use different products that you like to hold the mouth open. Talk about that a little bit.
Okay.
Because that takes a special care. That's not normal dentistry. People think that anybody can see any dentist, but geriatric oral care is special dentistry. It takes a special person and it takes special training. Am I correct, Doc?
Correct. And one of the questions on my questionnaire, so if you go to my website, Geriatric House Call Dentistry, there's a free resource manual for oral care.
Go there.
Okay, so it says free caregiver's guide to oral care. You can click on that to learn how to clean your loved one or the one you're caring for's dentures, how to brush teeth, what happens if you see blood when you brush. But the tool that you're talking about is my godsend. And this is the only thing on the market right now. And I'm gonna open it and I'm gonna demonstrate it. So it's made of a foam block that's very hard to bite. And believe it or not, I've had patients bite through it. I'm gonna put it in my mouth. I'm gonna show you how to use it because caregivers need to use this in order to brush the teeth. Because, one thing Sonia and I have in common, and we've had conversations about this, is when we go into a home or a nursing home and we see that pink sponge, we want to kill someone. Because that little pink sponge that you get from the hospital is meant to keep the mouth moist. You dip it in the ice and you keep the lips. That is not a way to clean your teeth. So
stop right there, Doc. Let me say this. I've known of people to aspirate that and that gets in their lungs and that can kill someone. It does not clean teeth. So go ahead, Doc.
Okay, it's like clean your sink with it, okay? Throw them out. So this is the only thing on the market right now. It's a foam block with a wooden stick. So what I do is the dementia patients, or even without dementia, like if they have ALS and they can't open very wide, if I could get it in their mouth like this.
Yeah.
The problem with this
is that
the stick breaks.
And then you got a problem.
And then you have a problem, right? And it happens all the time.
You have to put your fingers in at that point.
Oh my gosh. Well, here's the thing. 35 years I've been practicing. 35 years I've never been bitten. October of last year, had a caregiver holding the head, the wife holding the stick, and I was just cleaning his teeth. I wasn't doing an extraction or anything difficult. And he went, ah! And she pulled it out and he bit my entire fingernail off. First time and only time in 35 years. So I invented something like this, but you cannot turn it, and once it's in the mouth, you can't do that.
That's right.
It's a huge investment to keep not just dementia, but Parkinson's, ALS, all forms of Alzheimer's. And not only that, when you're old, you can't help it, you close your mouth. So if you have a product like this and you're a caregiver, you put this in, you put it on one side, you put it on the other side, you are able to brush effectively. Because the reason why older people get cavities is because they don't brush well and they don't brush around the gum line. The food lays there, the food lays there, the food lays there until you get decay, and then you get pain, and then it's a whole cascading problem until you end up getting all your teeth extracted.